Hi, welcome back. I am Tony Massey. I'm a psychiatrist, addiction medicine specialist at Colmac.
And I am Rennie Grant. I am a musician. I'm a producer still, and now I'm a drug and alcohol counselor, also at Colmac.
Great.
If I could speak, I could tell people where I'm from.
All right, so I'm Doc.
And I'm Rock.
All right.
Let's do this.
Let's do this. I've been hearing and actually reading the newspaper a little bit of this kind of controversy about addiction.
I'm scared. Controversy, addiction, wait a minute.
I get it, man. I think everyone thinks the same mind, don't you think? It's, addiction. Well, and this is, is addiction a, disease, or is it just people making choices?
Right, like you're a bad person. Why don't you just stop?
Yeah, well, and that dates way before the Nancy Reagan, just say no. This goes back, just
the temperance movement.
Temperance,
right?
Yeah, it's your temper. You just need to kind of change your temperance, your way of going about things.
Right.
So, I think maybe we could take a crack at it.
Okay, I have lots to say on that.
Just to make it interesting, because I think we'd be saying the same thing if we just so
right.
How about I could take the side of it's just a choice and you can take the disease, or maybe I'm a biology guy, I could take the disease.
You are a brain guy.
Okay.
So you might be able to explain the disease concept more articulately than I can.
Okay.
Even though I do agree with you. But all right, I will be the it's a choice guy.
Okay.
So every time I've ever picked up, it was a choice.
Decision.
It was a decision. It was my decision. Now I paid the consequences, and I understood that there would be consequences, but yet I still decided to use. So how is that a disease? I don't understand how that's a disease. I decide to rob a bank. I get caught. I go to jail.
Right. So action, consequence,
right.
Just like and to go a little bit further. The people that are pushing the not disease concept say that thinking of addiction as disease actually undermines people getting better, because instead they say, well, I'm not doing this because it's a disease.
Right, like it's an excuse. And
yeah, like I'm sorry, I have a disease.
I'm sick, what do you want from me?
well, I'm sorry, I have a fever. I got a disease, All
of a sudden, you just turn to Chris Walken, the producer sketch. I got a fever.
So,
well,
is there a point there? Is it, is this an excuse?
Well, am I still the disease? Am I still the anti-disease guy?
I don't know.
We're role playing, so I'm not
sure. Doing your stuff, man.
Well, the anti-disease people, is from what I see, they say. It's my choice, and I know what's going on, and all that. And I'm going to drift into the disease model just for a second, but I think people have a misunderstanding of what they mean by disease. It's not, in my opinion, okay, and this is strictly from my experience, but I don't believe it's a disease like cancer. I don't believe it's a disease that you go out and catch it. It's not a disease in the sense that you get sick from environmental causes. But it's a disease more like smoking. If I don't ever smoke, I will never, well, I won't say never, but the chances of lung cancer are very low.
Right.
Naturally occurring lung cancer is not high.
Yeah, in the 1800s,
disease.
If someone had lung cancer, actually they wrote a medical article about it because it's so rare.
Right. So now that when we smoke, smoking is a choice. The behavior is the choice, but the consequence is the disease model. And I think that if you go back to ninth grade, when some people, not me of course, but when some people started smoking pot, and like, hey, you're smoking, he's smoking, I think I want to try that. Maybe that's more of a choice. Maybe back in the beginning, it was a choice to get started, but when you're 35 years old and you're addicted to heroin and you can't get off, or if you drink every day, I don't believe it is any longer a choice. I think you've morphed into a distorted personality or character.
It's funny. I was thinking about diabetes. Because we can make the argument diabetes is not a disease, in the same way you can say addiction is not a disease. Because fact is that people talk about all these complications of diabetes, et cetera. Well, I think that's absolutely wrong. no one has had kidney failure because of diabetes. No one has had an amputation because of diabetes. No one gets blind because of diabetes. No one has this neuropathy where they can't feel on their fingers or feet because of diabetes. It's because of uncontrolled diabetes.
Like lack of management, is that?
Yeah. And, and really, and also thinking of like with diabetes, that a lot of people are a little bit heavy or too heavy in the United States and the rest of the world. A lot of people eat high, sugar, diets and, kind of thing. And not everyone goes on to develop type 2 diabetes.
Right.
But some people do. There's a propensity towards that condition. Just like in Vietnam, we had a lot of our service members using opium daily use of opium.
For extended period of time.
A year. More. Yeah. So out of that group, say out of the couple 100,000 or whatever that number is, come back to the United States. Did everyone go on and have a problem with opiates?
I'm going to guess and say no.
Yeah. Less than 20%.
That's about the average of.
Yeah.
Isn't that the ratio of addicts in general society, like addicted persons?
Yeah,
is
I think there's a
15,
I think there's
20%.
a predisposition that not everyone that has that exposure or makes these choices goes on to have the problems of the disease. So they just don't have that disease, and
by disease you mean sort of cognitive, cognitively speaking.
No, I'm thinking, physiology. Someone who have diabetes, but their blood sugar can be perfectly normal. It's just that that if you need insulin, you don't take that insulin, you're going to be out of whack. You're going to get sick. That if you eat 25 Twinkies in an hour sitting, for example, that
something I might want to try.
that's going to be a problem, and you may end up in hospital even because diabetic ketoacidosis. So, but if someone's well managed, they're like everyone else, which makes me think that someone can have addiction to disease, but just be, well managed.
Right. You mean in recovery or not having ever started the process of using?
Well, it's I would say in recovery, because I think that you wouldn't have necessarily developed the disease. Like someone may be predisposed to diabetes, for example, but never, never have obesity.
Let's take somebody who lives in a blue zone.
Okay.
Right? They live on Pitcairn in the South Pacific. There's no drugs and there's no alcohol on the island.
Got it.
This is back in the day, but they have the genetic disposition. Are they going to become coconut addicts? Are they going to become a sex addict? Do you think that would express itself in some other addictive behavior, or do you think it's tuned for dopamine type rushes?
Even
though I guess they all are really.
Yeah, my guess is that this sort of plays out in naturalistically as well. People have their favorite whatever drug, and maybe aren't so interested in some of the others. So, that person may be a little more likely to, have an addiction to some behavior.
Right.
Maybe like gambling, if they gamble on the island or something like that.
Adrenaline,
yeah. But it may just be that other stuff is not interesting, and only cocaine would have been, but you never had that, kind of thing, or only
that's very interesting.
Alcohol.
A tiny slice of the excitement spectrum really gets
just the way that the physiology is. So
interesting.
Yeah. So I think, and in terms of how you think of, if you look at that, kind of that idea of disease, then saying, well, you have this disease doesn't free you from the obligation, the responsibility to take care of yourself. Just like when you say, okay, you have diabetes, that means you need to start paying attention to your diet. If you're heavy, lose weight, control your blood pressure, exercise more, go to your eye doctor every year, all of these things
Self-care.
you need to do, So if someone says, okay, you have alcoholism, okay, well, then you need to, do certain things. You need to get community support. You need to avoid alcohol.
But I can do that on my own, right? Can't I just stop?
That is, I think, the crux of it. Some people can, and maybe it's some variant of the disease. There's all kinds of ways these play out. Just like, some people may be borderline diabetes and just, stop the, heavy sugars and go back to normal.
So you're saying there's sort of a bell curve.
Yeah,
okay.
But I think that a lot of times, people need more than that. And the fact is, and this is played out, we see this. A lot of times people can't do it on their own.
I see that more than that they can.
Yeah, Of course,
although I've met people who have.
You and I have a skewed view of the world because we see people who sort of filter to us.
Well, true. That 10 to 20%. That's our 100% of the people we work with. So.
Yeah, but there's a lot of people who do need somebody outside themselves.
I know we try to keep these videos short, and I know this is a little long, but I'd like to venture quickly into cognitive territory. Now, I know you're a psychiatrist, but I'm just curious what you think of sort of looking at addiction. My theory is that it's a bit of an OCD scenario, that once you start thinking of it, you just cannot stop those loops of thought. So I would consider that certainly, maybe, I don't know, is schizophrenia a disease or a disorder? It's a disorder, right? That kind of cognitive mental disorder.
Yeah, well, I'd say the schizophrenia would kind of be a little bit even on its own. I think we'd recognize that as a disease. But you're talking about the cognitive cycles, that there is some good evidence that the cognitive behavioral psychotherapy can help with the treatment of addiction.
So that would be really classifying it as a disorder, correct?
Well, it's a disease, just like OCD is a disease.
Okay, that's what I'm trying to get at. Like, so to deny that the disease of addiction is not just the physiological symptoms, but also a great part of it is the mental aspect too. I mean, it's kind of hard to deny that this is not a disease. It's like, the show Monk? It's like asking Monk to stop touching the corners of everything. He can't. If he could, if he would have years ago.
Yeah.
So I like it. That was a very interesting approach.
Well, we took way too much of your time.
They're loving it.
All right.
You know how we'll know they love it? They'll love. I'm going to steal something I saw. They're going to see down there where it says like. They're going to hit the like button, and then they're going to comment, "Man, you guys are awesome."
Good luck with that.
Thanks.
All right. So I'm Doc,
and I'm Rock.
All right. Have a nice day.
See ya.